Module 3, Misconceptions in Treatment for Addiction. So, the state, health, function and education of the PFC is what determines your self-control. It determines your time frame, as in, are you focused on the next few hours, or are you focused on what you want to happen over the next month or the next year. It also determines if you are able to avoid things that hurt your long-term health, including the long-term health of your brain and self-control. And thus it determines how much control you have over the use of alcohol, drugs, medications and other tempting short-term fixes that comes at a long-term price. So why is treatment not focused on improving you in this respect? Why are rehab programs not specifically targeting the changes that will improve your PFC and thus put you more in control? Why are there no education, training and treatment that is aimed at this kind of improvements? Why are alcoholics and addicts not improved by treatment in ways that make them less likely to relapse? Why is addiction treatment so inefficient that it has next to no influence on the relapse rate of the patients treated? Part of the answer is that addiction treatment is informed by a set of severely misguided beliefs. Beliefs that are repeated everywhere, even if they are proved to be wrong and never made much sense in the first place. In the next few sections, we're going to take a closer look at the way that addiction is understood and the different kinds of misinformation that makes it hard for everybody to deal with addiction or make improvements. Let's briefly go over the main misconceptions when self-control and the PFC comes up. First, the true nature of executive function is hidden by a reductionist understanding of short-term behavior. This is some simplified version of Darwinism, where going for the quick fix that will hurt you long-term is somehow natural, as if you were just being naturally greedy and doing what comes natural to you. And as if thinking about long-term consequences is not pretty natural for a human. Next misconception is that your level of self-control is genetic, predetermined, and cannot be changed. This is a great excuse for doing nothing, but it does not fit the evidence. Evidence shows that there are multiple different things that will limit your self-control and multiple different things that will improve your self-control. Next misconception is this. The way that the prefrontal function is usually explained is very abstract, focused on physiology and delivered in a medical jargon that does not make much sense to the average person. This understanding is so far removed from the challenges and choices of real people that it does not help people navigate the complicated lives that they face. If you're somewhat addicted to alcohol, you will also notice how the information is often presented in a very pejorative, arrogant and demeaning way, usually falsely implying that low self-control is a sure sign that you were a stupid person in the first place. The kind of language that is suited only to scare away the people who needs the information the most. And most importantly, when low self-control is discussed in relation to alcoholism and drug abuse, it is almost always viewed as a consequence. That is, low self-control is seen as an effect of using and almost never seen as a cause of using. This is perhaps not by accident. The task of gaining self-control is often framed in a vague and moralistic way that suggests that any failure of self-control is really a moral failure and that any victim of bad self-control is really to blame for his or her own misfortune. Not only is this not true, not only is this not constructive in any way, it is a major obstacle to improvements, and probably one used deliberately by people who in some way or another profit from people being weak and addicted. This is, of course, central to the modern understanding of addiction, and we will take a much closer look at this later.